we're able to stimulate neuronal growth and kind of induce a plastic state. So when you're thinking about a context of a psychedelic-assisted psychotherapy, essentially it's an altered state of consciousness, but it's a very plastic state of consciousness. So the person, again, is able to, even in a therapeutic setting, recreate themselves. It's about putting somebody in a malleable place psychologically and then molding them towards wellness and wholeness. Mystical experiences are kind of more meta-phenomena rather than something that's necessarily like been mapped to some specific part of the brain, but they seem to be kind of central and important to psychedelic work in that, especially with psilocybin and the research at Johns Hopkins, you know, they've kind of developed questionnaires, and I'll get into it in a slide or two, to measure this mystical experience, and kind of found that it's correlated with therapeutic outcomes. So what is drug-assisted psychotherapy? You know, is it, here's a bottle of ecstasy, go home and take one every day? No. And this is probably what a lot of people think about when they think of psychedelics as therapies, because the traditional model of psychotropic drug taking is to, you know, take a medication once, twice a day, and, you know, potentially on an as-needed basis for some of them, but this is vastly different in that it's a drug-assisted modality, and that there's a very limited number of exposures to the psychedelic, and it's all done within this greater type of psychotherapy intervention. So in the trials to date, they've had kind of finite numbers of sessions, between 1 and 3 psychedelic-assisted sessions, and these are usually kind of all day long, 6 to 8 hour types of sessions. And then on a weekly basis, they have 60 to 90 minute kind of follow-up sessions where they, you know, perform integrative psychotherapy, which Cherie is going to explain a lot more about later in the presentation. Depending on the drug, you probably want to space them a few weeks apart just so that the person can kind of get a handle on what happened. But depending on the drug, especially with MDMA, it does deplete neurotransmitters like serotonin, so part of it is giving the brain a little bit of time to recover between sessions as well. So how is it conducted? It's a very non-directive style of psychotherapy, and there's kind of this narrative out there, probably by Stan Grof, was the kind of first person to put it out there, but also a psychiatrist that works in addiction, Gabor Mate, kind of talks about psychedelics activate the inner healer. So the idea that the person has what it takes within them to heal themselves, and really, you know, mostly during the drug session, the job of the therapist is to follow the direction of the client and their experience, rather than to, okay, take some MDMA, wait an hour, tell me about your trauma now. You know, it's much more about letting their experience lead the process, rather than, you know, talking it out, essentially, in a psychedelic experience. To date, the trials have utilized a dyad of male and female therapists, so one male and one female. And they've probably done this for a couple of reasons, you know, depending on the type of person that you're dealing with. You know, maybe if you're using MDMA because you're a female and you've undergone some type of sexual assault, having 2 male therapists in the room probably isn't exactly what you need for that experience. Having 1 male in the room with 1 female may be kind of more helpful for you, more balancing for you, and depending on where you're at in the experience, maybe one person takes the foreground and the other person doesn't. Oftentimes it's done in kind of ambient surroundings, so again, the set and setting or context matters. It's not necessarily this whitewashed hospital room with very bright fluorescent lighting. You know, it's much more of a comfortable and ambient type of environment that the person is taking it in. They use music usually music without words. If there is words, it's words in another language, and it's meant to be evocative or emotion producing. And a lot of people would say that the music was helping to kind of guide their experience, or kind of led them to explore certain emotions at different points in the experience. So this is kind of a novel modality in clinical care as far as doing this type of research, but it's been it's been performed in underground or essentially illicit settings for decades at this point. This is the mushroom room at Johns Hopkins University. So you see that you have your patient here laying down with their eye shades on. They probably have maybe a set of headphones attached that we can't quite see, or I can't see. You know, they have some cool artwork and a nicely designed rug. It looks like there's kind of a mushroom lamp in the background there. And then you've got your dyad of male and female therapists, and she's not necessarily talking to the client at this point, but offering some touch as a form of support. So I'm going to talk about the mystical experience in the next slide, and certainly kind of in the headlines of psychedelic research, you hear a lot about the mystical experience, but I think that there's a lot more to psychedelic healing experiences than just being one with God and existing outside of time and space. I think oftentimes before that space is encountered, you have to encounter yourself, and you kind of have to face the things that you came to deal with. And oftentimes, people end up with really experiences that mimic the teaching of the mystics throughout the ages. Things like self-acceptance, forgiveness or letting go, gratitude for being alive, for breathing, for just being here, and as well as empathy. So maybe a combination of forgiveness and empathy for the person that actually assaulted you is the way of healing from your trauma, rather than just always keeping a distance and the guards up and things along that nature. Again, in research, you hear a lot about the mind and mystical experiences, but psychedelics are extremely psychosomatic. Especially ayahuasca is an incredibly physical medicine, but any of the others also have large somatic components to the experience a lot of the time. So things like shaking can occur where the nervous system is hyperreflexic and kind of shaking it out. Crying, laughing, oftentimes they're called to kind of stretch or move their bodies in some type of special way that they wouldn't, and then release of emotion through sighing or other types of expression. So what is the mystical experience exactly? Well, it's a profound spiritual experience, sometimes called a religious experience. They've kind of coined the term mystical because it maybe has less of a connotation, or it's a less loaded term than a religious experience, perhaps. But it essentially consists of a sense of true sacredness, that this is spiritual in nature and not necessarily just getting high or having fun, that kind of thing. Unity of all things, so oneness, so everything is one. Ineffability, so I love this word because it describes what you can't describe with words. And then a transcendence of time and space, so feeling that you're not existing in the same type of reality where time is passing somewhat linearly. It's measured with this tool called the Mystical Experience Questionnaire, and again at Johns Hopkins they've correlated the therapeutic outcomes with the degree of how mystical your experience is. And many people in these psilocybin studies will rank this experience as one of the top 5 most salient or top